Did you know that having a Dutch health insurance is mandatory when you start working in the Netherlands? Most of you have an AON student insurance, but unfortunately this won't cover it. And most of the time it is even more expensive than having a Dutch health insurance. So in this video we will walk you through how to get a Dutch health insurance, how you can get a refund from the government to pay for it, how the health insurance system works in the Netherlands, and we will show you a useful site to help you pick the perfect insurance for you. So how does the healthcare system in the Netherlands work? Basically, everyone above 18 years old pays a set amount of money into the insurance jar each month. This way, when someone needs healthcare, they can take a little bit of money out of the jar to pay for their treatment. This way, everyone in the Netherlands gets access to good healthcare. We also work with the free market. So we have private insurance companies that all are trying to keep the prices low to get as many customers as possible. This way we can drop the prices a little and keep it affordable for everyone. So when do you need a Dutch health insurance? Well, there are a few reasons. We have linked the government website in the description where you can view all the possibilities, but the main two are you get a new job or you do a paid internship that is paid minimum wage in the Netherlands. So keep in mind to get the health insurance when you gain one of these. The good news is that if you have Dutch healthcare, you are also eligible for Dutch healthcare allowance in most cases. This allowance helps you pay for the insurance. Each month you pay the insurance company the agreed amount of money, and in turn the government gives you an allowance to pay for the insurance. This way most people will get their insurance for almost for free. And you can check if you are eligible for the healthcare allowance in the description. So what happens if I don't get the Dutch health insurance when I have to? Well, unfortunately they will find out. We have an institution in the Netherlands which checks if everyone who's working also has the Dutch health insurance. If you don't, they will send you a letter, and from that point on you will have 3 months to get the Dutch health insurance. Otherwise you might get fined up to 400 euros. So we will recommend you to get the insurance as soon as possible. But as a side note, you can already start working without having the insurance. Just get it quickly. But I already have AON insurance, so I don't need the Dutch health insurance, right? Unfortunately, that's wrong. An AON student insurance does not meet the legal standards for Dutch health insurance. And when you start working in the Netherlands, the AON insurance won't cut it. So we recommend cancelling your AON student insurance and getting the Dutch health insurance. And remember, it might even be cheaper. So now for 4 steps to get the Dutch health insurance. First of all, you need to be eligible for one. So it means that you probably need a work contract in order to apply for the insurance. Then, after that, you can check which insurance fits you best, which one suits your needs, and which one is cheapest for you. You can compare them on a useful website which I will show you later. And then a little bit of patience. Before you can apply for the healthcare allowance, the database needs to be updated in order to prevent fraud. This is because some people ask for the allowance when they don't have the healthcare yet. So when the database is updated, you can apply for the healthcare allowance, and we will show you how to do that in a little bit. Now I will highlight one way to find a health insurance that suits your needs. We can use the website www.independer.nl. Here you can compare all the Dutch health insurances and add useful modules like physiotherapy and dental care. Unfortunately, the site is only available in Dutch, so we'll do a quick walkthrough and see what everything means.
So this is independer.nl. Here you can compare the health insurances. So you press the button with the heart in front of it in order to compare the health insurances. And then you enter your personal information. Some of it is entered for me here already. So this is your date of birth, your postal code, your sex, so male or female. If you're insuring any family members, yes or no. And then are you a student? And then you can pick between no, vocational education, University of Applied Sciences, the normal university, or different. So I'm going to go with this one for now, and then we can compare insurances.
The first choice we have to make is about the own deductible. In the Netherlands, appointments with your general practitioner are free. However, if you need healthcare in the hospital, urgent care or medicine, this will be first paid from your own deductible. The lowest amount of own deductible that you can have is €385. This means this will be the maximum amount of healthcare you have to pay next to your health insurance when you get hospitalized, for instance. You can also make this amount higher for discount on your health insurance. However, when you end up in hospital, then the bill might be a lot higher as well. So looking at your own situation, you can decide which own deductible suits you best. But I can say that most of us just have the €385 own deductible so that we don't have a high bill when an accident happens.
So for now we're staying at a €385 own deductible, and then we go further down and we can choose all the modules that you'll need. Most of the time you don't need any, but if you know that you'll need a lot of dental care, or maybe you need a lot of physiotherapy, glasses maybe, just check for yourself which ones you'll need and which ones will be like a good deal for you. Because if you pick this one, for instance, like you will get 100% insured up to €250 for dental care each year, then you're paying around €25 a month more for the insurance. So check if that is a good deal, or that if it's cheaper if you pay it out of your own pocket. So when you've picked all of the modules that you'll need, you can look at all the insurances that they listed here. And then first off, you see the cheapest and the best choice, and then a good alternative. And this one has more freedom of choice. But I'm guessing like most of us, we're just going to like the best and the cheapest choice. So you can look at that one. And here are some more details you can look at, maybe translate them with Google Translate. Interesting to see is that these are the hospitals in your regions, and you can see with the green checks that they are all fully reimbursed, so that's a good thing to check. And then when you know this one is the one I want to have, you go to Vraag aan, and you click that one. And they ask if you want this extra module. It's care in another country than the Netherlands. Most of the time you won't need it, but check for yourself. And then next step. And then they will need your personal information. So first off is your email address. I've entered a dummy here. Your info, first letters, anything in between, and then your last name. And then you can enter your postal code and house number, and it will pick the right address for you here. And also if you live on A, for instance, you can pick A over there. And for last one, you have to enter your mobile phone number, or any mobile number or any phone number that you are using currently. And then press next step. So then they have some additional questions. Are you living in the Netherlands? Most of you are. Then do you have the Dutch nationality? Most of you don't. So pick your nationality from this list. Let's say we're from Azerbaijan. Enter your BSN number, so the number that you got from the municipality when you moved here. And then the payment of your premium, monthly or yearly. If you pick yearly, it will be an amount of €1,567 in one go, and you get a discount of €15.84. It's easier to pay monthly because you get your healthcare allowance on a monthly basis as well, so you can use that to pay for it. And then last but not least, enter your IBAN, so your bank account number over here. And then you can press next step if you've entered everything, and then you can complete your request for the health insurance.
And now for the best part, healthcare allowance. On the website I'm going to show you, you need to fill out a lot of personal information. So I won't walk through with you all the way, but I can show you where to start.
So we're going to Mijn toeslagen. Just search for it, and then the top one is like the Belastingdienst, so log in over here. Then you can click on login using DigiD, and you can choose how to log in here. So you can use the app on your phone, which most people will have. It's easiest as well, or you can press English here, and maybe then it will be a lot easier. So then you're opening your app, and I'm just going to do that real quick. And entering the code that you see in your screen, after entering your password, of course. It's 4 letters, and then you press next on your app and you scan the QR code. There we go. Press login on your phone, and then the site will go through. So here we have some personal information. The top one is healthcare allowance. So mine is already filled in, but you can see here, like the gray ones, it says aanvragen, and probably yours will have that same thing over here at zorgtoeslag. You press aanvragen and you just follow the steps there.
And now just a few tips. Make sure you start your healthcare allowance on the same day you start your health insurance. Unfortunately, healthcare allowance won't be paid for a broken month. So if you start your healthcare insurance on the 15th of January, you will only get your healthcare allowance from February on. And also you have to make an estimate of your income. Just think about how many hours you're going to work and how much you'll earn each hour. And just make a rough estimate to fill out that space in the form. This concludes our video on Dutch health insurance. If you're looking for more information, you can check all the links we've put in the description, and also you can follow us on Instagram, Facebook and LinkedIn. Give this channel a subscribe to see any more useful videos in the future, and hopefully this has helped you picking the right insurance for you. Also, if you still need a job, sign up with Recruit a Student.